This is Caring for You, presented by Lady Care at Home. I saw Tammy.
She's back there.
And Crystal River. Jen, your friends, and I will let Jen take over.
So hi, I'm Jennifer from Crystal River Nursing and Rehab here in town, and today we have Peggy Stray with us from Waupaca County, and she's going to be going over some great items, so feel free to ask questions as we go and at the end as well.
Okay, so I'm Peggy Stray. I'm the new Elder Benefits Specialist for Waupaca County. I don't know how many of you knew Kathy Austin or were familiar with her position, but I replaced Kathy when she retired in September. And she retired at a really awesome time, didn't she? Because there's a lot that's happened since then. And I'm here today to talk about Medicare in the marketplace and its actual effect on Medicare. I don't know if we have many people in the room here who are not on Medicare. Not on Medicare.
It will be in October.
Okay. I serve people that are age 60 and over. We do have a disability benefits specialist named Karen Engel who serves people ages 18 to 59, but she only serves people who are disabled or interested in applying for disability. Me, I serve anyone over age 60. It doesn't matter if they're disabled. And if anyone has any questions about any of the programs that we have and don't know about some of the programs that we have, I'll give you my business card and you're free to call me anytime you wish if you have any questions. If you have any questions as we go along today, just feel free to stop at any point and ask. It doesn't have to have any certain kind of formal order, okay? So Medicare in the marketplace, this was a PowerPoint that was designed we have attorneys in Madison that actually supervise us, the benefit specialists. And it's actually a really brief PowerPoint. Does everybody have a handout? Because I do have some on the table. If anyone wants to take any notes, you're welcome to.
Does anybody need one?
The Centers for Medicare and Medicaid Services is CMS, and that is also who administers the marketplace. Now, a lot of people refer to this as Obamacare. That's actually the slang term for the Affordable Care Act. We call it the ACA or the Affordable Care Act. Many people call it Obamacare. Whatever you're comfortable with is fine. But the Center for Medicaid and Medicaid Services actually administers the marketplace, okay? So are you going to be eligible for it? Is it something that you should be pursuing? If you're on Medicare, how does it affect you? If you're not on Medicare, how do you get hooked up with it? How do you get aligned with the marketplace if indeed you do need private health insurance coverage? Because the marketplace is for people who either can't really afford their current health insurance or really, would like to look at other options that maybe are more affordable. Maybe you'd prefer to keep your private insurance, but the marketplace is just another place for you to get other insurance if you need it. There is a requirement that you have other insurance now, other health insurance, and as we go along, you'll see what that's about. Now, is everybody familiar with Medicare and the different parts of Medicare? Because there's something called the ABCs of Medicare also. And Karen Engel and I are working on a presentation, and we're going to be offering that regularly, possibly quarterly in different areas throughout the county so people understand the different pieces of Medicare. They call it, again, the ABCs of Medicare. There's Part A, Part B, Part C, D, E, F, G, H, I, J. There's a lot going on with Medicare. So the prescription drug arm of Medicare is actually called Part D. Okay. So we know Medicare is not the marketplace. Again, the marketplace is the health insurance exchange. If you are on Medicare, you do not need to go on the marketplace. In fact, you cannot go on the marketplace unless you meet certain very rare conditions. Medicare is your option. It's your best option. The Affordable Care Act has made a few changes that actually have enhanced your Medicare. So there have been some instances where it has affected your Medicare, but it's supposed to have been a positive effect on your Medicare. It is not a Medigap plan. I don't know if you're all familiar with what Medigap plans are. If some of you are on supplemental insurance plans, but some people, they can either be on standalone Part A and B. That's what everybody gets when they eventually get on Medicare. Not everybody will go into that a little bit too. Or they can join an Advantage plan, which is another wraparound form of health insurance coverage called a Part C. So it's Part A and Part B combined to make a Part C, or it can be Part A and Part B. A is hospitalization, B is your health coverage, doctor visits, outpatient surgeries, things of that nature, combined with even possibly the D, which is the prescription drug arm of Medicare. So there are a whole lot of things going on. The Medigap plans are supplemental plans that a lot of people pay for, well, many, maybe less than there used to be, when they first became eligible for Medicare. And you pay a monthly premium for those, and they're designed to fill in the gaps that Medicare alone cannot fill. That's why it's called a Medigap policy. Okay.
But that's different than a supplemental insurance.
Well, actually, it's the same. A supplemental insurance is designed to fill in gaps. Right. So really, Medigap is just another name for a supplemental policy.
Okay.
Okay. And as you can see, I don't know if you guys can read the PowerPoint very well, but the last bullet point talks about it actually being against the law for someone to sell you a plan in the marketplace if you are on Medicare. Is my thing not moving? Okay. Okay, people are eligible for Medicare at age 65. If your birthday falls on the first of the month, you're actually eligible for Medicare the month before the month in which you turn 65. So if your birthday is July 1st, you're actually going to be on Medicare June 1st. You have to contact Social Security to apply for Medicare 3 months before you turn age 65 if you haven't already started taking an early retirement Social Security payment. If you're already on an early retire Social Security payment, which starts at 62, you will automatically receive information about Medicare when you turn 65. You should contact Social Security again, like I said, 3 months before you turn 65 in order to get on Medicare, okay?
So how does that go, Peggy, like if you're still working at 65 and your employer has insurance, so then you don't need the Medicare?
You don't. Part A is something that everybody gets and it's free. It doesn't cost anything. They actually feel that you should apply for and receive the Part A as soon as you turn 65 and are eligible for the coverage. Part B is the other health insurance that most people think about when they think about health insurance. You know, you've got the hospitalization, which is A. You don't have to apply for the Part B coverage if you're currently employed or if you're covered by a plan through someone else who's currently employed, like a spouse. Because Part B costs money. The average that most people pay every month for the Part B premium is $104.90. That will come out of your Social Security check. If you do not want the Part B because you have other active coverage through someone's current employment, you can save yourself the money and the coverage by keeping your plan. Your plan would be then primary and Medicare would be secondary in that situation.
But you need to check with your employer sometimes too, because sometimes they will say,
Yep.
we will cover what Medicare doesn't cover.
Mm-hmm.
So
Yeah.
you need to check with your employer.
You're right. You need to be smart because plans are changing a lot these days. So you want to make sure that the coverage that you have through your employer is at least better than or equal to the Medicare coverage. It might be worth it for you to pay for that extra coverage. Keep in mind when you become eligible for Medicare, you have a certain window of opportunity in which to select it. You have basically 3 months before the month of or 3 months after. And then after that, there is an annual enrollment period every year from January through the end of March, and that means that coverage again does not begin until the following July. So there are certain periods where you can only apply and qualify for the coverage, okay? And, this talks about there being a late enrollment penalty. If you choose not to take one of these, A you would want actually, B, C, D, whatever. If you choose not to take it when it's offered to you and you wait and you didn't have creditable coverage, that current employment satisfies that, okay? With prescriptions, there's something called senior care that's only offered in Wisconsin that you can buy, and it's $30 a year. That's creditable coverage. You will not have a late enrollment penalty if you have creditable coverage. If you don't have the creditable coverage, and when you do eventually sign up for it, at that time, there's a formula that's calculated, and they will determine that your Medicare, that fee that you would have had, is going to be increased for life. And it could be minute in the beginning, but as the years progress, when you finally decide you want to sign up for it, it could be $10 more a month, and that could seem like a lot of money at that time. You know, money gets tight. The cost of living increase doesn't seem to keep up with inflation that you get.
For senior care, you have to be 65 also.
You do have to be 65 to qualify for senior care, but you just have to be 65 and a resident. It doesn't matter. You can have $1 million in the bank. Assets are not a consideration. There are different tiers because you may have to satisfy a deductible, but then after you satisfy the deductible, the largest deductible is $850. After you satisfy that deductible, your generic drugs at this time are $5, your brand name drugs are $15. So it's a really good deal. But you have to apply for it, pay the $30, and allow that processing to take place the month before the month of eligibility. Did you have a question?
Yes, when do you become eligible for Medicare? The month before your birthday?
If your birthday falls on the first of the month.
Oh, only if it's,
Only if it's
otherwise
on the
it's the month
first.
you turn.
Yes. Mm-hmm.
I got a letter from Senior Care yesterday,
Uh-huh.
and they said that unless your doctor takes Medicaid patients, they won't honor the prescriptions she writes.
Well, that I haven't heard of. I'll have to check on
I just
it.
got it yesterday.
So that may have been a change. I haven't seen any
I
changes come
should've
through
brought
on
the
senior
letter.
care.
Now it's coming.
Senior care will only pay for Medicaid approved drugs, but it pays for a lot of drugs, and it's a really awesome option. And it's only offered in the state of Wisconsin throughout the entire nation. So it's an extra layer of prescription drug coverage. Every year you'll see that our legislator will go and vote on it to see if they have the money to continue the plan.
Now
But
that's
if-
senior care?
That's senior care, yeah.
That's
And-
for drugs.
Right, that's for drugs and drugs only, and if you don't wanna take the Medicare Part D, because that's gonna cost on average $30, $35, $40 a month to have the drug coverage with Medicare. If you're only taking one pill a month, and get on the senior care and pay $30 for the whole year. It's creditable coverage, you won't have a late penalty. And then that one drug you take, if it's a brand name, it's $15. If it's generic, it's $5. But it has to be Medicaid approved. That's the one thing. I have seen people who have had heart issues that have an $800 a month drug. And I had a person call me one time and say, I just found out today I have to take this $800 a month drug. They were not on Part D. I'd like to, get on senior care. Sure, you can get on senior care, but it's not gonna cover that drug today. It's not gonna cover that drug until that application is processed in Madison and that $30 payment is received. And so, yeah,
Starts
and then
again
it
on
reviews
September
every year.
1st.
But there is no open enrollment period. You can do it any time throughout the year that you're interested in applying for senior care. It's an awesome option. So
So
we
should
kinda
you
got.
take that even if you're not on drugs? I mean, is that something we should apply for ahead of time? So if something comes up and then you have to take the $800 drug, you've already got it?
Yeah, in a way, for $30, you have that extra layer of insurance that you
That's
wouldn't have.
$30 a year.
Yes, it's $30 a year. And the other thing about it, and I know we've kind of gotten off topic with that, is it will cover people who end up in the donut hole with their drugs. Some people drop off into the donut hole. Senior care is kind of that extra layer that helps throughout the donut hole, okay? Let's see. So this talks a little bit about the fact that you have to pay a premium if you haven't enrolled in Medicare. Some people don't become eligible for Part B, which was kind of a surprise to me. I thought everybody at age 65 got Medicare, but not everybody does get Medicare. You have to qualify for it. Let me just see. I had it written down here so I could tell you the exact specifics. Okay. Most people at age 65 or older who are citizens or permanent residents of the United States are eligible for free Medicare Part A. And that is because they receive Social Security, are eligible for railroad retirement, have a spouse who was eligible for it, or a dependent parent if you're a fully insured child. Some people get it because they're children and they're disabled. but it's really based on your work order history too. And I had another person call who had been married to a younger man. So this is the case where being married to a younger man might not be the smartest thing. Because they had been married, you have to be married at least 10 years in order to qualify for a Social Security benefit as a retiree through your former spouse. But this person had divorced her husband, and now she was 10 years older than him and could not qualify for Medicare until he went on retirement because she did not have enough work orders to qualify herself. So she was in kind of a pickle. So there are people that are going to be 65 or older that may in fact still qualify for the Affordable Care Act because they don't get the Medicare coverage at 65. So again, this talks about how at different levels, when you do reach that Medicare age, you can fall into late enrollment penalties. Okay. And not sure if anybody in this room is familiar with Social Security disability, but people who are found disabled by Social Security that are not age 65, doesn't matter what age, but when you're found eligible for Social Security disability, you don't get Medicare until the 25th month. You actually have to be disabled for 24 months until you can actually qualify for the Medicare coverage. So those people too would be interested in possibly applying for and getting coverage under the Affordable Care Act if they don't have other insurance that they can get.
Isn't that Affordable Care Act closed now for this year?
It is. Actually, that's the other thing. It is closed for now, although there are some exceptions because some people did have some difficulties processing their application, and we got a memo that said if there's anybody that actually had difficulty doing this during this period, they will look into possibly allowing an application because, there was a little confusion in the beginning. I think we had an example where, and I've seen this before, people will have gone to the marketplace and made an application and be rerouted, assuming that they were eligible for Badger Care. Badger Care is a form of medical assistance that used to be available for, well, it is available for families, but there was a period of time where it was available for single childless adults. And so many people applied, I want to say this was like 4 or 5 years ago, that they had to actually close that window of opportunity and put people on a waiting list, okay? And those people have really not been able to get that coverage. Well, with the Affordable Care Act, those single childless adults, if they're under 100% of the federal poverty level, which right now is $958 a month for a single individual, will be funneled to Badger Care. But some people were incorrectly funneled to Badger Care. So when those Badger Care applications were processed, and they were processed 3 months later than they initially thought they would, they were supposed to have started January 1st, but there was a delay, so they weren't actually eligible until April 1st. Well, people that were incorrectly funneled through the Affordable Care Act people into Badger Care have now found out, you know what, I wasn't really eligible for Badger Care. I would have been eligible for the Affordable Care Act. That started in January. Now I went for 3 months without any coverage. What are you going to do about it? They are reviewing those cases. So that's another consideration, okay? So there are, as in Medicare, Part A, Part B, Part C, Part D, there are special enrollment periods in which people can be found eligible for the Affordable Care Act as well. And also, the other piece to this is there is something called SHOP. I don't know if you're familiar with that within the marketplace, SHOP, but that is coverage for people who work in businesses that employ 50 people or less. So there are a couple different ways of being funneled through the system. And I've brought information when we're finished that I'm going to pass out to let people know how they can, when that window of opportunity arises again this year for next year's coverage, how they can apply for the Affordable Care Act, or if you know someone that you think should have and did miss that opportunity and doesn't qualify for a review. Because right now then they're going to have to go for these 6 or 7 months without any coverage until it opens up again. Okay, so
Why do they close registrations? Why isn't it ongoing? Why do they close it?
why did they limit it to ending March 31st for the entire year, just to
Yeah.
reopen up again? I don't know why they did, but they do that for Medicare as well.
Right.
So I don't know, because they don't want people to be uninsured.
Right.
So what they're doing is setting some people up to be uninsured. I don't know.
Because people will procrastinate and not get on there. That's why there was the big rush at the end of the deadline period.
Probably.
Right, yeah, you know, it's like that bulge
Push
coming
people
out in
just
the
to
end.
do it.
Mhm,
Right.
mhm.
And, you know, you can get coverage, some of the plans in the marketplace can be dental only, and I was reading that, that was an offering that was only gonna be available in states that were not federally run. We are a federally run program, but I did some research and it looked like we can still have dental standalone options if indeed we're interested. But again, those are people that are not on Medicare, which not all Medicare plans cover the dental. You know, unless you're an Advantage plan, some Advantage plans cover dental, some cover hearing, some cover vision, some cover two of both. But, so that's, you know, kind of a new concept for me, the dental piece.
I'm not on Medicare, I have private insurance.
Mhm.
Could I go on the marketplace and get only dental coverage?
It sounds like in Wisconsin you can, but again, if
But
you
not this
haven't-
year.
Yeah, again, if you hadn't enrolled and you don't have a reason to review some enrollment that didn't take place properly, you may not have that option. But I'll give numbers. People are always welcome to call the numbers and see if at this time they would still accept some kinds of applications, because you know, I'm not sure they have the numbers that they were hoping they'd get, so maybe they'd be interested in opening that up if they heard from a lot of people. I don't know. Okay. So here are some scenarios. Jim has Medicare Part A only, hospitalization only. He didn't enroll in Part B during his initial enrollment period. Remember we talked, there was a period where you can. He signed up for Part B in January 2014, but he's not going to get it now to July 1st because he didn't do it when he was initially 65 during that 7-month period that he could have. Can he enroll in a marketplace plan while he waits for Part B to take effect? And I have an answer to that here. Because now we're on.
I would say no, because the enrollment is over.
You are right. No, because you know why? Not because the enrollment's over, because Medicare Part A is considered minimum essential coverage. Remember, it's illegal for anyone to sell you a marketplace plan if you have Medicare Part A is minimal essential coverage. That's the other caveat. Part B is not considered minimum essential coverage. Part A is. So that's the reason for that. Okay, now we know we have another example. Check your knowledge here. Barbara works part-time, isn't getting Social Security retirement benefits yet. Her employer does not offer health coverage, so she is enrolled in a marketplace plan. Her Medicare initial enrollment period ends next month, but she decided to keep her marketplace plan and wait to sign up for Medicare. Will Barbara have a late enrollment penalty when she signs up for Medicare Part D or B or D or what else? Will Barbara have a late enrollment penalty because she decided to keep the marketplace plan even though she could have signed up for Medicare during her initial enrollment period? That's a tricky one, right? Okay.
She's over 65.
Yeah, she's over 65, but she's working part-time. So she hasn't taken her Social Security retirement yet, and her employer doesn't offer a health plan. A lot of people continue to work part-time after 65.
I would say,
Mhm.
I'd say yes.
So she's
I'd
only
say
on
no.
Okay.
I'd say or maybe.
Okay, well, it is twisted. It says, you can choose marketplace coverage if you're eligible for Medicare but haven't enrolled in it yet. Because you would have to pay a premium and you're not collecting Social Security. So it's kind of twisted. But before making this choice, there are 2 important points for Barbara to consider. If she enrolls in Medicare after her initial enrollment period ends, she may have to pay a late enrollment penalty. So being on the marketplace doesn't mean she's not going to have a late enrollment penalty. Generally, here we go, she can enroll in Medicare only during the Medicare general enrollment period. And in if her marketplace plans prescription drug coverage, because you can get that too, and not all the drug coverage on the marketplace plans are considered creditable coverage. So it gets even deeper than that. She may also have to pay a late enrollment penalty for the Part D. So hers is really a unique situation, and if I were her, I would investigate both the marketplace, but possibly talk to me and see if choosing an Advantage plan or perhaps going out in the market buying a supplement or maybe even getting Part D would be a wiser choice in the marketplace. So there are times when the marketplace is going to be a wise scenario for some, depending upon their income. Because remember, the marketplace offers different plans at different levels, and I'm going to give you some information on that. I don't know if you've all heard about how it's been paired with kind of the Olympics. You know, they have the bronze, the silver, the gold, and the platinum plans. That's what people compare them to. And then the coverage is based on which plan you select, and your premium is going to be based on your income, your family size, the plan you select, because it starts low, the coverage is like 60-10, 70-30, 80-20, 90-10, so the higher you go. And then under each one, you could be possibly dealing with a different insurer that offers different benefits at those levels. So it's very complicated. That's why so many insurance agents have had to learn so much about it, those that are selling the plans, which I'm sure Terry probably has heard about.
Yeah.
It's a very complicated thing. So, but really, Medicare is a good program, and it does meet needs in general. And I think that my experience with the Medicare program, as limited as it has been in the last 7 months, has been a good experience. I know that things have changed with it, but it's been an overall good experience. Okay. Now, one of the things that people wanted to know is, how did the marketplace affect Medicare? Well, enhanced services, it's provided more in the way of preventive services. It has, for some drugs, reduced some of the co-payments. It eventually, in the year 2020, will close the donut hole. That will end, hip hip hooray. There will not be a donut hole in the year 2020. So who knows, you know. There are a few different ways to actually get connected to the marketplace. Your information I gave you on that tiny little slide at the end gives you some of that information. I'm going to give you some separate information. We have had people here locally that have been able to meet with people and sign them up for the marketplace. I haven't heard anything about whether that assistance will continue that now that March 31st has passed. But we did in March, every Friday, I think the last 3 Fridays in March at Goodwill down here in Waupaca, they had someone that could assist people with enrollment. People were very happy with it. People would go on the website and mostly call the 800 number. For a while that was even better than the website, because there's a website, healthcare.gov, there's an 800 number. Even if people were feeling, you know, pretty good about what they had entered, they just weren't comfortable hitting that final button, like, is this really true, is this really right? They could go to these people and those people would help them, and it was awesome, and I never heard anybody say anything, they had a bad experience. We also had people in Clintonville at the public library who were assisting. We have people in Iola that were assisting. Those assisting moments came later in the season, you know, as they tried to get the program together, but I imagine in the coming years it's just going to get better and better. So, and one of the other ways to apply, and I have a pamphlet here too, other than going on the website or calling the 800 number or going through one of those assisters that is hopefully locally, you know, somewhere local that you can access. There is a website too called Access, and I have pamphlets on it. It's been around for a long time, but now it includes information that can allow you to funnel into the Affordable Care Act, especially Badger Care. So what's really nice about Access is when people go on this website, it'll ask a lot of questions, but it won't just ask questions about health care. It'll say, maybe you'd like food share, maybe you'd qualify for energy assistance. I mean, it has other things that you might not even know you're eligible to receive. And when you complete that, it triggers something in our economic support office for them to contact you and then set up a review and see if you really are eligible for any of those programs. So I like Access a lot. It's an awesome website option. So, anyway, does anybody have any questions?
Is that for a certain age group?
No. No certain age group. And I mean, energy assistance, like I said, anything, it's really awesome. So I'll give you these pamphlets too, so. I've done a lot of talking. Does anybody have any questions?
Well, what are the changes in Medicare that might affect people who are already on it?
Well, it just enhanced it. It's going to close the donut hole eventually. So the donut hole every year is going to get smaller. So that's
What
a
is the
good thing.
donut hole?
Oh, the donut hole. Oh, you haven't heard of the donut hole?
Not as tasty as it sounds.
Yes. Terry, good point.
It's not on one sheet.
That's a slang term for a coverage gap. Some people are on medicines that exceed the amount that Medicare has agreed to pay during their initial coverage. And I can't give you the exact number, but medicine can be expensive. So if you're on a really expensive drug, you can fall into this tasty donut hole right away in the year. And then while you're in it, and it lasts just a certain period of time, so they say it's like this. You're going along, you're on the initial coverage level, your drugs are
In
being
Medicare.
in Medicare, your drugs are being paid for on the Part D, and you're on these expensive drugs, and oh my gosh, Medicare Part D lasts a year, and every year we review it and renew it. And then you fall down this cliff and you've fallen into that donut hole. And then let's say
Why? They
because
changed
maybe
coverage?
maybe your drugs were really expensive and you spent, I'm just going to use this as an example. This is the exact figure. Let's say that you have to spend $5,000, the government does, $5,000 on your drugs before you fall into this coverage gap, it's called. So some people easily could, if you have a drug that's $800 a month, after 4 or 5 months, you've expended that amount of money that they've allotted for you, and this is something they allot for each and every person.
For a year.
Yes.
Or forever.
It's
Yeah,
for a
for a
12-month period. So at month 4 or 5, I've seen people fall into it in month 1. I mean, yeah, you can, because there are some pretty pricey drugs. So they fall down into it, and then they have to spend money equivalent to, let's say, a couple $1,000s in drugs before they can climb out of it, and then they're in what's called catastrophic coverage and they're covered again. You really have to have some pretty pricey drug needs, but it happens really more frequently than we think, that people fall into this donut hole. And so it's really going to be great when that closes. The nice thing about it when
And
you're...
that's not till 2020?
2020 is when it'll be
But
closed.
it's gonna, you said it's gonna decrease.
It's gonna get tighter and squeeze. Yeah. And the nice thing then about us being able to have senior care, thank the Lord, in the entire nation, is we can get on that and use that while we're in that period of donut hole before we climb out again.
But that's just Wisconsin.
Just Wisconsin. So, but when you're in it, when you do get your drugs, it's not like you're gonna be charged full price. Your pharmacist can only charge you certain amounts for your drugs. It's less than you would pay if you had to pay full price, but still it's gonna be more than you were gonna pay when you were under the initial coverage before you fell in. Then you're in there a little while, you satisfy that dollar amount, you climb back out, you get a pretty good rate for your drugs again. The year ends, you start over again. So,
And then you go back in the hole for the next year again?
you can, yes.
Wasn't the donut hole also affecting people that were born within a certain range of years, like 1918 to 1930, or?
I don't know.
That's a different
I
hole.
don't know.
That's a different donut.
You gotta have raspberry fill.
I don't know, that I don't know, I guess I thought, yeah.
Maybe the
They're-
people that have already, most of them have expired by this
I think they are beginning.
You'd be surprised
there
how many
was-
haven't. Yeah.
There was some years where people, and I think you're right, I think they're beginning to pass away, and that's not gonna be a problem anymore, but there are some people that were born in these certain years, and somehow the government somewhere missed this group of people,
Oh.
and they don't get as much for Social Security. They don't get as, much for Medicare, and they have struggled, and they never fixed it, they never repaired that. And I don't remember all the instances, but that's something different.
Yeah, I don't know because I wasn't involved at that time, but I do know that well, from what I'm told, Part D, the prescription arm of Medicare, hasn't been around, I think, when the donut hole was created, 7 or 8
Right.
years, I guess?
That's fairly
Maybe
new.
10 years? I mean, it's really a necessary thing, and it wasn't always there.
Bush too was president,
Oh,
and he sold out to the drug companies.
Yeah.
What is Part C of Medicare?
Part C is called an Advantage Plan, and it's a wraparound health coverage that's administered by private insurance companies. Right now, there are 3 pretty popular plans that people enroll in this area. They are Network, they are Humana, and they are AARP. But there are probably 7 or 8
And why do you
choices.
have that? Why would you
United
have
Health,
that?
which is AARP, yeah. Well,
Is that your supplement?
well, no, a supplement is something different. A supplement, okay, they said think of it like a block of cheese. If you have standalone Part A and B Medicare coverage, you're going to have to set aside, for the Part B that you pay $104.90 a month out of your Social Security check, you're going to satisfy this year a $147 deductible before it's completely covering all of your medical needs. If you are hospitalized, Part A is free, but this year you'd have to satisfy a $1,213 deductible before you would completely have all of your medical needs met. But that doesn't, I shouldn't say completely. You satisfy the deductible, but then Medicare A and B standalone will only, after those deductibles are met, pay 80/20. You're always going to be responsible for 20%. Right. An Advantage plan will kind of lock that up. You might have an in-network maximum, and you might never get there. Like with some insurances, you never use your maximum, and then again you might. You never know what your health is going to be like. Network is a PPO, it's a preferred provider organization, so you have more flexibility. The other 2 that I mentioned are HMOs, so they're a little more restrictive, but it costs less to be in them. So all of it is basically a guessing game on what your future is going to be like when you decide to make that choice, right?
So when you first qualify for Medicare, you have to decide if you want Part C?
No, you.
And Part
well,
C, there's a cost to that?
They're,
That's a premium?
they do have free, they have 0 premium, 0 deductible plans. A lot of it's going to depend on your health. Sometimes, yeah, there is a cost to it. Network has 3 different options. Right now, they have a plan that's with or without drugs. If you have the drug plan, it's $87 a month. If you don't have the drug plan, it's $46 a month. But then you're sacrificing the drug coverage, and you're maybe going with senior care because you can't have Part D separate from that. You have to go with the drug coverage that comes with your Advantage plan provider. Yeah. There is a network plan that costs $227 a month right now. But you know what? Every time when you go in the hospital, you don't pay anything.
So I'm really confused with these A, B's, and C's.
I know. That's why we're going to do that.
So, this isn't part of this? I
Oh,
shouldn't
but
ask
no, that's
questions on
okay. You
this?
can ask. No,
Oh.
that's why there's a need though to do that.
So do you have to make the choice that you either take A, B, and D, or you take C? Or you don't take A and B and you take C?
No, well, when you initially get Medicare, you're going to have A and B, and it's called standalone Medicare. If you want extra coverage, and I didn't finish my thought on that, A and B, they said think of it like cheese. A and B standalone is going to be like Swiss cheese. It's going to have some holes. You know, it's a guessing game. Are you going to have medical bills? Are you going to have out-of-pocket expenses? You don't know what your health is going to be like. You can then add the Advantage plan. There are a whole bunch of different choices.
You have to have A and B before you can go to the Advantage programs or the supplement program.
Yeah, you can't not have A and B. That's, you're right. The requirement is you have to have the A and B coverage to
And
choose
you want
that.
A and B.
And you do want
You
A
want
and
A
B.
and B.
Yes.
That's, you take that, absolutely.
Right, you do. C is more like Colby cheese. It's gonna have a few holes. You know, it's going to be a little more restrictive, but it's going to be better than the standalone A and B. And then when you buy a supplement, that's like a solid block of cheddar cheese. It's going to fill the gaps, the things that aren't covered, but you're going to pay more for a supplement, you know. So it depends on what your health is like. It's really a guessing game. At the end of every year, and you see this because you guys probably get inundated with mailings, or commercials. But from October 15th through December 7th is our annual open enrollment period again for you to select your plans for the year following. Most of them are drug plans, but a lot of times that's when people switch to the Advantage plans too, which they have a little more time to do after the first of the year if it's an Advantage plan, make some changes, but
What were those dates?
October 15th through December 7th.
Is open enrollment switch plans?
Right. When you first become Medicare eligible, you have 7 months, 3 months before, the month of, and 3 months after in which to select a plan. But then after that, you have to wait for that open enrollment period. It's not open like all year long.
So you have to have A and B, and then you could get the supplemental insurance?
Yes, then you can do that.
Or, and you have A and B, and then you could get Advantage plan?
Right.
So depending on your personal health, you would have to decide, do you want the Advantage plan or do you want the supplemental insurance?
Right, and they
Is that
say too, with the supplemental plans, in your first year, if you do select to purchase a private plan, like a supplemental plan, your health isn't going to be counting against you. It's not going to increase your premium or anything like that. After that first year though, they can start looking at your health.
So then your premiums would go up
Yeah,
in the
so-
supplemental plan?
Yeah, and your first year is your really most important year for you to make those decisions that could affect you forever.
So is that supplemental insurance something you would go to the marketplace and get?
No. It's something that most of the time people go to private insurance agents and purchase. But it is something, if you go to Medicare.gov, there are different plans that can be reviewed. And you can actually review that with me too. I can help a little bit with that. I'm not an insurance agent, so I always feel like they're more knowledgeable about the supplemental insurance plans at this point, but I'm happy to help, so.
So in what ways is Medicare gonna be better?
You're gonna have some preventive services that you didn't get before. I don't have specifics on what they are, but I know that they opened up the preventive services. Oh, you have it. Oh,
But I don't understand it.
Oh.
But I printed it off yesterday at home.
oh,
I
What is
believe
it,
that
Finland,
it's a
Joanne?
wellness, a yearly wellness.
more wellness.
Exam that you could go into your doctor and that's covered and your wellness, yeah.
Annual wellness checkups.
Yeah.
But you have to make, this was my question yesterday, because we'll be going in soon for my annual checkup.
Mhm.
And I wanted to know, because I got different private insurance this
Oh.
year. And so when I called them, they said, we will cover it at 100%, whatever the health care plan says is required. And you can go to healthcare.gov and print it out. So I went there and I printed it out. Well,
Okay.
I can't read it.
I know it's.
It was like, okay, under my, but the response that my health insurance is whatever is in the Healthcare Act, we will cover it 100%. So you gotta go and figure out, okay, what does the Healthcare Act really say for wellness
Yeah.
to find out what it covers.
Right. And they also can't discriminate if you do have a health issue in the Healthcare
Mhm.
Act. That's part of the changes that have come with the health insurance. Even with your private insurance, there shouldn't be any discrimination. But I do know, after that first year, when it comes to supplemental, so I'm told there still can be that. In fact, supplemental plans can be very expensive for people that are disabled because they're gonna go on Medicare earlier in most cases, and insurance companies, if they see somebody who is under age 65 on Medicare, they know they're a disabled person. That's the only way they were gonna be eligible. So those can be expensive too, but that may change. All of this is a work in progress, so.
I have a question.
Mm-hmm.
On the, go back to the donut hole,
Yeah,
not the hole.
yeah.
How are they shrinking it? Have they raised the amount that you spend before you fall into it now? Because I know they lowered ours. I have a D plan,
Oh, okay,
and it was $2,900.
right.
It went down to 2,880. So it went
Oh.
down rather than up because of the Obama.
And you would have thought it would have gone the other
It
way,
should have went up, because each year it was going up.
right?
It would go up higher before you fall into normal.
Uh-huh,
But that year it went down because of Obama
right.
Act. So I'm wondering how is it gonna close the donut hole?
That's a good question, because I guess I was
Because-
thinking the same thing.
Because I'm thinking, well, I should be able to spend more before I fall into it.
Mhm.
But I don't know what it is right now. Did it go up? Did the
Maybe they're
amount-
closing it from the back end more than the front end, then, it sounds like.
Close
I
the
haven't
back
heard. Yeah, they're closing the back door.
Well, they had, what, I guess you gotta spend $4,500 out of pocket.
Mhm.
I mean, you can fall into the donut hole real fast because it's, they're taking your out of pocket plus what they pay.
Mhm.
Boom, I had one drug, I ordered twice, I'm in the hole.
Exactly.
And that's an accident.
Mhm. Yes.
Like, 2 prescriptions is like $1,000, or 1,000 each.
It's amazing.
I got $2,000, over 2,000 of that, I'd fall in the door right away.
So you need senior care.
Well, I don't take it off.
But I mean, it's good while you're in the donut hole to be on the senior care.
Well,
Yeah.
so if you already have if you get Medicare Part A and B, and then you have a supplemental insurance, so should you also take senior care because it's only $30
Yes,
a year?
yes.
Just because
Because
it
that's
might.
the drug
You
company.
have, what,
Right.
right,
But so is your supplemental insurance.
right. That is not covering drugs. Supplemental does
Right.
not cover the
But
drugs.
my mother falls into the donut hole real fast.
Mhm.
And, so she needs to be on
Senior care.
senior care also. But you said it only covers certain drugs. Is there a listing
You
of
know,
those
there is a
somewhere?
listing of drugs, and it is on, if you Google senior care
Mhm.
and covered drugs, there is an actual spreadsheet of all, it covers a lot of drugs. It really does.
I would think so.
What do you have to qualify to?
You only have to be a Wisconsin resident. You don't even have to be a Wisconsin resident for a specified period of time. You just have to be a Wisconsin resident.
Own property in
And-
Wisconsin?
Huh?
I think, own property in Wisconsin?
I'm not quite sure.
don't
I
think
think
you're
you have to be a
resident.
Wisconsin
Where you vote, isn't
resident.
it
I
kinda
don't
like
think-
where you, if
Yeah.
where you vote is where you're a resident
Right.
or
Or where you pay
something?
taxes?
Right, I think you really need to be a
Not even
resident.
taxes.
No, you have to live here, you
What about
know.
income? Is it
Well, the income, it doesn't matter what your income is, but ultimately what happens if you have a really high income is you're gonna fall into, I think it's tier 4, which is the highest level. And then before you would have coverage, you have to satisfy an $850 deductible on your drug expenses. Then after you've done that, you pay $5 for generic, 15 for a brand name. So,
If you have Medicare Part D,
Mhm.
can you also have senior care?
yes,
Okay, you can have both.
you can have both, because it's the D that causes you maybe to fall into the donut hole. Some people don't have D though, because they just don't take any drugs and they don't wanna pay for a Part D plan. So they just take the senior care, and it's creditable coverage. It's not gonna give you a late enrollment penalty on the D if you don't take the D. That's the nice thing. When you finally go on D, even if it's 10 years later, you aren't suffering negatively.
Could you have senior care and not Part D?
Yes, absolutely. A lot of people do that too. Save themselves $35, $40 a month if they don't really
Especially
have
if
any
you're not
drugs.
taking drugs when you go on Medicare.
Exactly. So it's really smart.
Yeah.
Did you have a question, Becca?
How did Wisconsin get that?
I would say on average, it's between 25 and 40. You can get plans that are $12.60. You can get plans that are more expensive. Yeah. Well, you can get a zero plan. This is the other thing too. Some people, if they're at a certain income level, qualify for extra help. And when you get extra help, which is something that's requested with Social Security, they will pay the Part B premium. Your drugs, you will not have to pay a premium. It will be a zero premium for your Part D plan, and your co-pays will be significantly reduced. You can also contact our economic support, which is this 888 number that I give you, and ask for, well, it's called QMB or SLMB or SLMB Plus. We call them Quimby, Slimby, Slimby Plus. And those, I know, those programs that really are the same as extra help, they're just being determined at 2 different agencies. That pays that $104.90 a month. That goes back on your Social Security check. You have a zero premium for a Part D plan, and your co-pays are significantly less. So there's a lot out there. Just nobody really knows about it all.
Does that access, will that access tell you that?
Yes, Access exactly will tell you that. It'll funnel you directly through, so. Does anybody else have any questions?
did you say?
Were my ears open?
Yeah, was I paying attention? That with the marketplace in Wisconsin, that we accepted federal monies?
We did not accept the federal money.
Right.
So we're governed by the Fed. Aren't we governed by the feds? I think that we are at the mercy of the federal government to administer our program because we didn't accept the money to run it ourselves.
Yeah, they're paying us.
Oh,
Yeah.
we didn't accept the money to run it ourselves.
So we are under their administration for our program.
Which change if we had done it ourselves?
I don't know the specifics of that. I know that we're one of those few states. I'm not quite sure how many that didn't take the money, and so we are.
So why have you ever gotten any reasoning why we didn't take the
I
money?
think that, from what I understand, is it's like Health and Human Services, which is where we work. They mandate a lot of programs for us. They give us the seed money to start those programs. The seed money goes away. We still have to mandate the programs. That money then has to be supported by county taxpayers. And I think that was the general consensus. He was afraid that that seed money was going to end and then the backs of that program would fall on the taxpayers of Wisconsin, so.
That's usually what happens.
So if we're
Yeah.
governed by, how does that affect us then, if we didn't take the money and we're governed by the federal government?
Well, our premiums might be a little bit higher than they are in other states. Our
For-
startup took a little bit longer because we were at the mercy of the federal government's, website versus having created our own. So I don't know all the specifics of that. And I don't know if it's something that because he didn't take it the first time that he can't not take it again. I don't know. I'm not familiar with how that
Usually
works.
strings attached to getting
Yeah,
money.
yeah.
There's a lot of strings attached to it,
So that was
But
really
they're
the premise.
still attached because they're still mandating.
but they're running it.
Yeah.
We're not paying for it yet.
Right.
They're running it.
They're
They wanna turn
basically
over
running
us,
it.
They
Yeah.
have to pass a law,
Yeah.
say, okay, you gotta do it. But
Yeah.
right now, that's why I don't think he wanted to take it, because it's like she said, seed money. You get you started,
Mm-hmm.
you say, okay, the funds are here, you run it yourself.
Yeah, that was, I think, the reason
But
why.
isn't that what Badger Care and everything is anyway?
Well, Badger Care is medical assistance, and medical assistance is state and federal, so there is money funneling into Badger Care that was before. But the Badger Care before the Affordable Care Act came into being would test single people, single childless adults, or people in general at 135% of the federal poverty level. Now, it dropped that ceiling to 100%. So that's the difference. It used to be here, now it's here. So. That lady looks very knowledgeable.
Need her for a sidekick.
Been there a lot.
So, any questions? Any others? I have some information here I want to give to you though, so. Anyway, it was nice speaking with you.